minorities have less access to healthcare. My name is Dr. Erica Steele. I'm a holistic doctor in family practice. I hold 6 degrees in my field, and they're all in the natural healthcare space, and I went to school so you don't have to. So there are several reasons why minorities have less access to healthcare, including systemic racism, discrimination, language barriers, lack of transportation, and even poverty. These factors can make it more difficult for minorities to access healthcare services, which can lead to poor healthcare outcomes. It's important that we address in the healthcare community these barriers and work towards increasing access to healthcare for everyone. Minorities do face multiple barriers and unique challenges to accessing healthcare, including systemic racism, discrimination, language barriers, lack of transportation, and poverty, as mentioned before. But also, it's really a lack of cultural connection. A lot of times, providers don't necessarily understand different cultures and how different cultures go about doing their healthcare. They often rebuke any sort of thing that's outside of the typical norm, such as, let's say, dietary restrictions or resistance to allopathic medical treatments, or even just a lack of or some hesitancy in general to more aggressive treatments. They really don't understand in general in healthcare, and they're not taught in healthcare to really be very culturally sensitive. I know in my own education, it wasn't until my public health degree that I really learned about the impact of different cultures on healthcare and how that can impact. So these barriers can make it more difficult for minorities to access healthcare services, which can then lead to poor healthcare outcomes. Systemic racism and discrimination can result in unequal access to healthcare services for minorities. For instance, minorities may have more likely to receive lower quality of care or experience biases in the healthcare setting. I know for myself, I've heard many stories of medically gaslighting people that can result in reduced trust in healthcare professionals and the healthcare systems overall, delayed care, missed appointments, etc. Language barriers also contributed to limited access to healthcare services by limiting English proficiency, and that can result in difficulty in communicating with healthcare professionals or understanding healthcare information or even navigating our healthcare system. This can result in delayed diagnosis and delayed treatment. And so I've seen this even in myself with my Hispanic patients, me not speaking Spanish myself, and having to have access to interpreters and various different people just to be able to help bridge that gap so that people understand. Also, again, there can be some resistance because our healthcare system is very different than a lot of healthcare systems all over the world. And there is just this overall distrust in the minority community in general to some of these more aggressive treatments. Medications are not often used in various different cultures, and not that medication doesn't have its place, but there's a lot of education that needs to take place well ahead so that people really learn how to take care of themselves. They understand things like water, things like diet, the importance of their mental health, their emotional health, and how their lifestyle can really help impact their health overall. A lot of times I find that people of different backgrounds and cultures are often dismissed. Their concerns are often dismissed, or even their hesitancy to move forward is often seen as resistance or sometimes called non-compliance. And so it really creates a very adversarial healthcare relationship with various different people from different cultures. I know myself, I tend to work as an advocate to really help educate people, both the healthcare professional as well as the patient, on what the different options are, what the different treatments are, so that we don't have delayed care and missed appointments, and we are able to build a lot more trust within the healthcare community. Because if there's a loss of trust, then of course nobody wins. The healthcare professionals don't get to help, as well as the patients don't get the help that they really need. We definitely don't want to delay treatment because that can lead to misdiagnosis and then having to do more aggressive treatments overall. Moreover, lack of transportation can limit access to healthcare services for minorities, especially those living in rural or remote areas. Lack of transportation can result in missed appointments and delayed treatment, which can lead to more severe health conditions and higher healthcare costs. That was one of the reasons why I chose to go more telehealth and do more telehealth treatment, so that I am able to really access those populations that otherwise wouldn't be able to gain access to a holistic doctor, because there's not a lot of holistic doctors all over the country. And so being able to not only travel to different populations in different areas of the world, but also to be able to work telehealth has allowed me to really access and reach out to different people from different cultures to really be able to support them in their healthcare goals. And now with a lot of infrastructure in place, we're also able to ship and help people gain access to labs where otherwise they wouldn't really be able to do that. So I'm really excited about the future of our practice as we move more in that direction. Poverty is also another issue, a key issue in healthcare, because a lot of times with healthcare, it's very expensive. So one of the ways that we have really worked to bridge that gap is providing low offerings such as $50 physicals, or we'll do patient education like these kind of videos where we're able to give people the tools that they need at a low, if not no cost. Things like supplements and lab testing and medications, of course, can be very expensive, and with limited healthcare coverages, it can be a challenge. We really want to be more preventative in our approach. We want to start early. We want to start when they're children to really educate the children on what health means. I know when I'm working with my holistic families, I'm really teaching them to be able to educate their children early on about what it means to be healthy. That can include water, food, etc., and teaching them their mental health, their emotional health, well-being, and teaching them early on what it means to be healthy so it can prevent disease rather than having to constantly be reactive in treatment. Proactive care is by far the more affordable and more effective route rather than just waiting around until something happens and then boom, now there's this big medical expense, higher healthcare costs, and a lot more stress that's involved. So we know that poverty can be a significant barrier to accessing healthcare services, and low-income individuals and families are more likely to be uninsured or even underinsured, which can result in limited access to healthcare services. Poverty can also result in difficulties paying for their healthcare services and even just healthy food in general, i.e. food deserts. Medications can also be unaffordable, which can lead to untreated illnesses and delayed care. So in order to address these barriers and increase access to healthcare services, we really need to work on expanding initiatives, expanding education, and increasing funding for community health centers all over the country. And as we increase diversity in our healthcare workforce, that also helps to open up and expand, because if you have no experience, you really don't know. We want to work on increasing healthcare access to all and improving and promoting health equity. Addressing these barriers can limit access to healthcare services for minorities, and that's really essential to reduce those barriers to ensure that everyone, regardless of their race, their ethnicity, their socioeconomic status, has access to some quality healthcare services. By working towards health equity, we can reduce healthcare disparities and promote better healthcare outcomes for all.